You know, it's every aspect of what we do has been consumed by this over the last couple of months. We actually started preparing for this in advance of it being called a pandemic or even an epidemic. Anticipating that supplies would be in short demand, we started bulking up on what we could, trying to get everything so that we could sustain ourselves. As this thing has progressed, we have seen every one of our fears basically come true in terms of getting supplies and being prepared and so forth. So we, we've changed the way we're doing business. Obviously, you see behind me, we're screening people outside the building, trying to prevent anyone that might be symptomatic as defined by the CDC, outside and screened, and if appropriate, we test them based on the guidelines from CDC, Alabama Department of Public Health.
It's a pre-screening before you go into the hospital. You come up, and anyone who walks in the building is pre-screened, whether they coming up for x-rays or labs or just our ER services or to one of our outpatient clinics, because we have one clinic we particularly have to keep open because patients are on a treatment regimen, so they have to stay open. But outside, they come up, and this is employees, patients, families, anyone. They come up, we ask if they have any symptoms. As far as respiratory symptoms, it's routine stuff, and then we take their temperatures. Anyone with a temperature over 104 is 100.4 is screened, and for further, why do you have a fever? Because there's many reasons to have a fever, anything from a urinary tract infection to anything else. So we go that route and try to figure out why the patient is sick. And then if they have fever as well as respiratory symptoms, those are the patients that are more likely to be tested for the COVID-19 virus. We have screened over 60, somewhere between 60 and 70 so far. We've got about 50 to 60 results back. Thankfully, they've all been negative. Lots of people think they probably need to be tested, but if they don't meet the testing criteria that's been established for us, because there's a very limited amount of testing kits that we have available to test our residents. But we test anyone that the physician feels is suspicious.
And it's not that we don't want to test everyone. The supplies to test, the collection kits, are not plentiful. I mean, we do have a supply, much better now than we did in the beginning. But the labs are being overrun, and what should be a 3 to 5 day turnaround time is, gone way beyond a week. So we've been requested, by the state to test when appropriate and not to test, other than that. So, but I mean, we've been having daily briefings. We have calls with at a national level with CDC and CMS, which is the federal government. We also have calls with the Alabama Department of Public Health and the Hospital Association 2 to 3 times a week. We're trying to stay abreast of everything and do everything that we possibly can to protect the people here in Brewton. I got to tell you, everyone has been super. The mayor's office, local businesses, individuals doing anything and everything. Even tonight, the local churches are coming together to show support for the hospital, and those things mean more than I think people realize. Brewton is so fortunate to have a facility like this. I mean, as far as rural hospitals go, I don't know of any that have the capacity and the capabilities that this hospital does. Long history here in Brewton. The support with the medical staff and the community, is extremely beneficial for the community. We're prepared as best that we can be prepared. Obviously, we don't have the capacity of a large facility, but I don't think you'll find anyone more capable than our nursing staff and our physicians.
This is completely new for us as far as an infectious disease causing these type of crises. The only thing that's come close was Hurricane Ivan, when the hospital had to stand alone for weeks on its own before we could get any assistance at all. And for us, right now we've tested a lot of people. Thankfully, all have been negative. We will get some positives, I expect, and when we do, the whole nature of our business here and how we take care of patients will change, because we will very much have to limit visitors altogether for patients. We will have rooms just set up just for patients that have COVID-19. Nurses in full protective gear, which we use very rarely. It will change how we do business, and then a lot of our routine admissions will just we're just going to have to encourage our physicians not to admit them, because we don't want to have them in contact, even have the chance of getting this virus.
You know, we do hope this is not as bad as it can be. You know, we're just like everyone else. We're concerned for our patients, their families, our physicians, our nurses and their families. These are some brave folks that come in here every day and face, you know, what could be, you know, unknown at the time, but you find out later. And they, you know, they have families that they're worried about too. We're just like everyone else. So they're doing a good job. You know, we respect and try to do everything we can to prop them up. And the city has you know, been overwhelming in donations of food. They're feeding these folks back here on a regular basis. Equipment. We have purchased equipment from a number of places that we probably would never even thought of. You know, whether it's an auto parts store or a tattoo parlor. You know, because when you start looking for these very specific things that are used for personal protection, you know, you don't care where they come from. You just want to have them available for your staff and for the patients.
You know, you'll come up with these respiratory disorders during this time of year with sinuses and cough and this kind of stuff. If something lingers and then you develop a temperature after that, those are things that you need to be seen about. 100.4 is the fever guidelines that's been given to us by the federal government, and so that's the one we're using when we screen patients. But the anxiety level with this is so much higher with patients and their families and our staff than it was with like a natural disaster. Because once a natural disaster, everything was gone. It was then just taking care of business after that. And of course, we talked about the symptomatic things. They have fever or they have cough, any of those type of things. And the patients are then masked, and then if they're able to, they walk around to our other treatment area, and the ER is notified, and they come outside and see them in that area. If they can't get around there, of course, we roll them around there. And once they're there, the physician comes out and he evaluates them. And if he feels like they need some additional testing, we can do testing outside, or we bring them inside into one of our negative pressure rooms. We have one of our negative pressure rooms has an outside door. We bring them directly in there, and they're in a negative pressure room. It pulls everything outside, all the air, and the patients, and then have blood work, x-rays and everything right there inside the ER, but in a confined space. Just like Mr. Owens said, the city and everyone around, a lot of the companies have just been tremendous in their generosity giving us stuff. But right now I do have a need. I have a need for hand-sewn masks. We are going to issue those to patients and our staffs and everything. So I'm asking for the churches and other organizations around, if they could provide us with hundreds of hand-sewn masks, it would be extremely helpful. These masks are primarily used to protect others from me. If I have one on, I'm protecting someone else beside it. We have pretty much made a decision that anyone coming in the building is going to get a mask. Because my regular mask that we use for medical patients is in limited supply, we're going to put one of these masks on temporarily on all of our patients, and they can carry them home and laundry them and use them after that. And our staff, primarily not our clinical staff, but our non-clinical staff, when they're here, are in the building.